Hey guys, so I want to go ahead and now finish chapter 6, our nervous system chapter. I'm going to go ahead and share my screen with you guys, and let's take a look at just the end of this chapter. So we finished up the last section talking about the brain. So the last image on our slide, remember we were talking about this, the cerebellum, which controls our coordination. Here we're going to take a look now at the rest of the nervous system. So the rest of the nervous system, so here again, just to look at the next slide, this is the spinal cord. The only thing I really want you guys to be familiar with the spinal, about the spinal cord is that it's in control of our reflexes. I think I mentioned that real briefly in the first video, just talking about again what happens when I lay my hand on a hot stove, how we immediately respond to that. That's what's called a reflex. And so we briefly talk about that here in just a second too. The reflex arc is what we'll see. And that's controlled here in the spinal cord. You don't have to know anything about labeling or anything on the spinal cord. So this is just a good view of that though, to see that. So this shows you just, again, another viewpoint of that, but we'll look at a different picture later of the spinal cord to show that reflex continued there. But with that, it is responsible for what we talked about with the afferent versus efferent nerves. Remember we talked about how, you know, in that situation where I lay my hand on a hot stove, that when I lay my hand there, yes, we do immediately remove it, but that's because there is an ascending sensory tract that sends that message. Again, that was the afferent. That message is sent up to my spinal cord. My spinal cord will then interpret that and tell my hand to move. And so that's then through the descending motor tract. So motor meaning there's some type of response that needs to be elicited here. So that efferent nerve will send that message through the descending tracts and then to my muscle where my reflex will take place. We'll see that that action. So that the spinal cord is the reflex center for those spinal reflexes. So again, we talked about just knowing the difference between afferent and efferent. Afferent are your sensory nerves, efferent are your motor nerves. There are such nerves that are mixed. You guys don't need to worry about those. Just know that the difference between the two terms, afferent versus efferent, that's what you guys will be tested on. This just shows you again how that's, you know, put together. Again, the nerve connected here to the spinal cord. You can see if we were to break down that nerve a little bit further, pulling that apart, you would see then here are your neurons that we talked about in the first video. So let's talk about that peripheral nervous system a little bit further. Remember the nervous system itself could be divided into the central nervous system and then the peripheral nervous system. We talked pretty heavily about the central nervous system in the last video when we talked about the brain and in great detail, and then the spinal cord is also included in that central nervous system. Now the peripheral. The peripheral can actually be divided a little bit further. We have, you know, again, if you remember the picture that we drew, let me see if I can, or not that we drew, but we had in our book. Let's see, this picture right here. So we've got the nervous system, remember, then divided into the central, so that's the brain and the spinal cord. We talked about that in great detail, that brain. We talked about specifically the cerebrum, which again divided into our different lobes, controlling lots of different things like our hearing, our speech, our motor movement, and so on. In the diencephalon was the center of our brain area. The thalamus, which again is the thalamus, which is the relay center for our brain, our brain's operator, switching station there, per se. And then we have the hypothalamus, which again is our brain's regulator. So it controls things like sleep, appetite, emotions, body temperature, things that keep us pretty regular. Our digestive function, our urinary function, and so on as well. Then we have the brain stem, remember, divided into the medulla oblongata, the pons, the midbrain, and the reticular formation. The only thing I really wanted you guys to focus on that was the medulla oblongata, as again, remember how important the medulla oblongata is in that it keeps us alive, right? Remember, it controls our heart rate, our breathing, and our vital functions. So those vital functions. And then we have the cerebellum. We ended that lesson there with the cerebellum. Again, cerebellum controls our coordination. So that's what we talked about with the brain. In this video, we're going to talk about this peripheral nervous system. So we just talked about, again, the difference between afferent versus efferent. So we've got our afferent, so those are the incoming messages. Those messages are sent directly to our spinal cord for interpretation. Once that spinal cord, or well, those reflexes, I should say, to the central nervous system, because the brain could then control these functions as well, as we saw everything the brain does. So those incoming messages are sent to our central nervous system, so those don't have any further expansions here. But the efferent, these are outgoing messages. So our motor nerves are controlling lots of different things in our body. Because again, if you remember, we've got 3 different types of muscle tissue, right? We talked about this in our muscles chapter. We have skeletal muscle, which again is our voluntary muscle that we control. Again, me waving my arm around in the air right now is because of skeletal muscle allowing me to do so. But we also have cardiac muscle, which controls our heart rate, right? We also have smooth muscle, which controls lots of other organs in our body, such as our arteries, our digestive system, our urinary system, just any other movements that are taking place in our body. Food has to move from our stomach through our small intestines, and that is because the small intestines are lined with muscle that's going to slowly contract and push it through the small intestines. We'll talk more about that in digestion. However, that is movement, and everything is controlled by this nervous system. So this is how this is going to be divided up further here. Our outgoing messages either control our voluntary movements or our involuntary movements, and that's the division you're seeing right here. Our somatomotor, or sometimes just called somatic nervous system, these are our voluntary movements. So this is our skeletal muscle being controlled here. So controlling, the brain, again, remember, messages that are coming out control, like, again, our ability to walk across the room, our ability to wave our hand in the air. These are the things that we control, and that's what this is referring to right here, our somatomotor. Whereas everything else is controlled by what's called the autonomic nervous system, and that's what this is referring to right here. I always associate the word autonomic with automatic, because all of these functionings are things that happen on their own, things that I don't have to think about. My brain really kind of does it for me. All of our body's autonomic functions would be our heart rate, our breathing, digestion, our kidneys filtering and creating urine, my liver, my pancreas. Everything is working kind of on its own. My sweat glands, everything else works on its own. I don't have to tell it to do so. And that's the autonomic nervous system. And that's what we're getting ready to talk about right now, which can be further divided into the parasympathetic and sympathetic. And I'll show you guys what I mean by that. All of our automatic functionings are working in one of 2 ways at any moment. We are either very relaxed and nothing is really affecting, a strain in any of our functionings in our body, or we can be really excited, really stressed. We're exercising, or perhaps something has scared us and we need to defend ourselves. That is the difference between these 2 terms. When our body is acting in kind of an abnormal state, when we're in a stress state, that's going to be the sympathetic system, and then the parasympathetic when we're relaxed. So let's go back to that. So let's see where we were. Let me see if I can get back to the spinal cord. Okay, I think we are here. Nope. We're here. Okay. Sorry. So the autonomic nervous system, as we mentioned, is subdivided into then the sympathetic and the parasympathetic divisions on the basis of anatomy and function. So again, the purpose is to maintain homeostasis in response to changes in our internal conditions. So this is going to affect our cardiac muscle, smooth muscle, and all of our glands. Really, it affects lots of different things. What happens is, specifically, yes, our cardiac muscle, because it's going to change our heart rate, our smooth muscle as well. And let me tell you why. Because what happens, here's again, the sympathetic response. And I think that's what we might be getting ready to talk about. It's going to show that our sympathetic division of the autonomic nervous system really controls all of these different things. What happens, think about if, say, you're in some type of emergency situation and your body is in just fight or flight mode. We've got adrenaline running through our veins, pumping through, giving us all that energy that we need. So adrenaline's going to help with that, which we'll talk more about adrenaline in chapter 8. But all these things are happening that we need to prepare ourselves in order to survive. We go into survival mode. And all the things that happen in our body are helping us to do that. And here's how that sympathetic nervous system does that. Controls all of these different things, dilates my pupils, gets my salivary glands, where we produce more saliva should we need it. Our heart rate is increased, controls our lungs, so our bronchial passages are opened up so that we can intake more oxygen, so that because we're, again, taking in more at the time, so we're going to need that. Slows down digestion because all of our blood is, everything is focused on really, different things. So digestion and our urination is slowed down. Those, not urination, but I mean, the creation of urine is slowed down in the kidneys. Sometimes depending on how scared we are, sometimes involuntary control of our bladders, of our, urinary sphincters release, and sometimes causes that to happen. But the process of the kidneys filtering out blood is going to actually slow down. All kinds of things. All kinds of things are, our sweat glands are then activated so we can produce more sweat. Our liver, we are, controlling the what's called glycogen release from the liver, which is where our body gets excess energy should we need it. So there's just lots and lots of things that are happening. The thing to really remember is what happens when we're in this type of stress response. The more noticeable things, we breathe heavier and our heart beats faster. And that's kind of the big thing that I focus on a test too, that when our nervous system is active, our sympathetic nervous system is active, then we are in a stress response. And those are the most important kind of responses that you guys will think of. So that's what that division is doing. Whereas the parasympathetic division is the opposite. It's our body trying to get back to a normal state. So once we realize the threat is over, we don't need to be in survival mode anymore. Our heart may still be racing a little bit, even though we know that it's over. But we'll talk about that later. That's still adrenaline in our bloodstream, and we're slowly getting rid of that. But it slowly calms down, and that's the parasympathetic division. Oops, I didn't mean to click forward there. And so, not mentioned on the slide here, but the parasympathetic is simply just our body going back to a relaxed state. So that's the difference there. It's just, again, our body maintaining homeostasis. We want to be here. So when something throws us up here where our heart rate's whoa high and our breathing is crazy, our parasympathetic will bring us back down to normal. So that's the difference between those two. I always associate the word sympathetic with stress. I just remember S for stress means S for sympathetic, if that helps you guys remember that too. As I mentioned, we'll end this with our reflexes. I just wanted you guys to remember what a reflex was, and again, that it's controlled by the spinal cord, and really that's all you guys have to know. But what it is, again, is simply just an involuntary, predictable motor response to a stimulus without any type of conscious thought. So again, when we lay our hand on a hot stove, we don't have to sit there and think about it. We will immediately move our hand because, again, our reflexes tell us to do so. If something is flying at our eye, we know to blink. Our eyelids know to blink without any type of conscious thought. That's also a reflex. So there's lots of different examples of reflexes, and that's what that is. So it occurs in an arc that involves a receptor, so something that receives that sensation. So say, again, my hand on a hot stove. When my hand's laying on that hot stove, the receptors in my fingers pick it up. The afferent sensory neuron sends that message up to my spinal cord. There's an integration center there in the central nervous system that interprets that as, hey, that's super hot, you need to move your hand. So then there's the efferent motor neuron that sends that message back to my muscles in my arm, and the effector in that case is the muscle. So that just kind of shows you that step-by-step process, and you guys don't need to know all that. That's just, again, exactly what we just mentioned. The dendrite of the neuron receiving the stimulus, the sensory neuron that carries that signal to the central nervous system, either the brain or the spinal cord that interprets that message, the efferent neuron, and then the effector. So sometimes the effector can be skeletal muscle, which again, in that example it was. That's a somatic reflex because it's skeletal muscle, or perhaps maybe a sweat gland, or something in my body, my smooth or cardiac muscle. That's an autonomic reflex then. So this just shows you that process. This is specifically the knee jerk reflex. Oh, no, I'm sorry, this is not the knee jerk. This is stepping on a tack, which obviously would hurt very much, but we don't have to really think about that. We subconsciously will then remove our foot as soon as we step on something painful. So this shows you this response. So it shows you the more of a visual of this step-by-step process taking place. Here's the receptors in the foot that are receiving that sensation of pain, but there's then the sensory neuron, the afferent neuron that's sending the message to my spinal cord. Here's the integration center that's going to interpret that as painful. Then the afferent neuron here, which is the motor neuron, is sending a message. In this case, it's another somatic example, so a somatic reflex controlling the muscles in the thigh, which are going to then pull the leg back away from the tack. So just another example of that reflex arc to see what a reflex is. So I would be familiar with those reflexes. I always cover memory. Memory is something I like to talk about in really all of my classes because I relate it so much to studying then. There are 3 types of memory. We have immediate memory, we have short-term, and we have long-term memory. A lot of times I think people think that the memory they have is the memory they're stuck with, but that's actually not true. You can actually build your brain, which sounds kind of crazy, but you can actually change how the messages are fired and the neurons are fired in your brain, and you can actually build upon your memory. And, so that's what we're looking at here, that there's immediate memory that lasts only about a few seconds. Anytime we need to maybe remember a phone number. Sometimes we look it up, and I can look it up on the computer here maybe, and I see, okay, it's 555-1367. Okay. And I dial 555-1367 long enough to make the phone call, and then it's gone. As soon as the phone starts ringing, I don't have to remember it anymore, so it's gone. That's immediate memory. Lasts only a few seconds, sometimes to a few hours. I'm sorry, that's only a few seconds. But short term lasts a few seconds to a few hours. So it's only just right there with us at that very moment. So maybe somebody told us something, that we had to do, and we remembered it. But then, if there's a distraction or we start doing something else, then sometimes we lose that memory and we forget. Then our long-term memory these are actual chemical changes in the neuron. After some time, we start building up changes to these neurons, so resulting in growth of dendrites and formation of new connections. So an example would be like studying. It's one thing when we're in class and we're listening to a lecture and we hear it and we go, okay, that sounds good. If we don't go home and study that, it's only in our short-term memory. Remember, short-term memory can last up to a few hours. Everything sounds pretty good and we feel like we've got it, but we'll start to lose that information should we not continue to look at it. So that's where studying comes in. It's a way to change our memory and to put things into our long-term memory. So it's that constant repetition. Using another example that maybe we're more familiar with, the first time you hear a song, sounds great. I like it. I remember a few of the words, but I don't remember everything to it. But the more you hear the song, the easier it is for you to remember all the lyrics. So we remember lyrics because we hear the song over and over again. Or perhaps maybe the first time we drove to a friend's house, we needed our Google Maps. We needed our map on our phone, and our map on our phone told us the turn-by-turn directions. We've now driven there 37 times. I don't use my map anymore, right? Because we've driven there so many times, because it's now part of my long-term memory. I know the directions by heart. So that's the difference there. And so I always bring that up because I, again, stress the importance of, since we're talking about the brain, I want to show you that you can actually change your brain, and stress the importance of that studying in any of your classes, because it is physically possible to change your memory and to build that up. So a reminder here at the end, our function of our nervous system, it's fast, efficient communication with one part of the body, or for one part of the body with another part, using those action potentials, and those are what we called impulses throughout today's chapter. The function can be demonstrated through identifying different pathways, and the pathway can be written for what's occurring here, so just what's happening at that very time. So our nutritional requirements for our nervous system, so finishing this up here, just sodium, potassium are actually something that's really important for our nervous system to maintain We didn't talk about this in the chapter, but it's what's called resting membrane potentials. Sodium and potassium moving across the membrane are actually what causes our nervous system to function properly. So just know that sodium and potassium are very important for our nervous system health. Fat is actually necessary in the diet, especially to children who are growing and developing their neurons, especially with the developing of myelin. We talked about myelin as it surrounds the axon, so it helps to insulate those axons. So that's why breast milk and formula is actually has a lot of fat in it, because it helps in the nourishment that those children need. So effects of aging on our nervous system: our cognitive ability increases in the young, remains very stable in adulthood, and actually starts to decline in old age. The definition of old age will always differ from individual to individual, as old age is only really affected by how well you take care of yourself too. So sometimes old age could happen earlier in some people than it does in others, depending on their nutritional status, their family history, their health. There's all kinds of different factors that go into that. Short-term memory is affected pretty early. Verbal skills will start to decline around age 70. Intellectual performance may remain high until the age of 80. Reaction times will start to slow as our neurons become less efficient, and the number of neurons in the brain is actually going to decrease with age. Okay, guys, so that is the end of chapter 6. We will continue this week. We're still going to take a look at chapter 7, so that's just the end of this chapter. So if you want to go ahead and move on to the next video and take a look at that.